do mouth care if that's alright with you. Can I pull your privacy curtain? Off your bed. Like your wills. You guys practicing your wills? I'm gonna gather some linen, so I need 2 towels. One for their chest, one for a barrier on the table. So if you guys don't have extra towels at work, you can always use a pillowcase. Sometimes towels are a little bit hard to find and washable. You can always use like a pillowcase for a barrier. Use that quite a bit. There's no shortage of pillowcases. So get them up in a high phallus position, so 90 degrees if possible. That way they don't aspirate. I don't want fluids to go down in their lungs. It always helps if you put a pillow behind their head, behind the shoulders a little bit. Okay, if I put a towel on your shoulder, I'm sorry. Start talking, sorry. I'm gonna gather some supplies. That's toothbrush, toothpaste, and a basin and a cup. Get a cup of water. And put my gloves on. So you need to be cautious if they're on thickened liquids. I wouldn't use regular water. If they're on a fluid restriction, or if they're NPO, nothing by mouth, you wouldn't want to use regular water. You have to be very cautious. And I would use a Toothette. I don't see any, but let me see if I can find one real quick. What a Toothette looks like. Toothette. And this is what you'll probably have for your steak because it's disposable. So if I had someone that was on thickened liquids or nothing by mouth, I would try to open this. There we go. And I would fill this with half Listerine and half water, and then I'd stick it in there. And wring out as much as water as I could. They're on a fluid restriction, anything like that. Right. If you're using this for your state test to be the toothbrush, if you didn't have a toothbrush, you wouldn't stick it in there. That's just if they're on a restriction or something like that. Normally, like for your state test, you'll pour water over your toothette. Put a little toothpaste on it. You will have a real person that you're doing this with. And they're looking to see if you're actually getting in the back of their mouth, if you're brushing the inner teeth, the outer teeth, and the chewing surfaces. That's why they use a real person to make sure you are actually getting in there. So I'm going to brush the upper inner teeth. You have to verbalize what you're doing. The upper chewing surfaces. Upper outer teeth, just going up and down. Okay, you need to spit. Okay, I'm gonna brush the lower inner teeth, the lower outer teeth, up and down if possible. Put your teeth together, please. Up and down. And the back chewing surfaces, lower chewing surfaces. Will you stick your tongue out so I can brush your tongue? toothbrush. Have you rinse your mouth. Oh, spit. If you don't mind, spit. There you go. Wipe your mouth off. Rinse out my equipment and I'll be right back. So if you use a toothbrush, this would be considered equipment. You would rinse it off. Touch your emesis basin. Dry off your toothbrush. Dry out your emesis basin. At that point, I can remove my gloves and put everything away. Glove to glove. Skin to skin. Down my hands. I'm not gonna lower you all the way since you had some liquids in your mouth. Like semi-Fowler's, like a 30 to 45 degree angle. If you're wondering if they're semi-Fowlers, if you look at the side of the bed, there's like a little marble that actually say the actual degree that you're at. She's at a 30, so I'm gonna put her at a semi-Fowler's, which is 30 to 45 degrees. This is good. Hey, do you want your call lights?